Hi friends, it's me Nidhu. Welcome to my YouTube channel Helping Hand for Nurses. In this video, I have included 25 questions that were previously asked in RRB Staff Nurse Exam. Also, I have included answers with explanation. So please watch the full video, and if you like this video, please like it, share it and subscribe it. And also click the bell icon so that you will get notifications if I am uploading new videos. So let's start the video. First question, the permanent stopping of menstrual cycle in women is called. Options A. Menopause, B. Menarche, C. Dysmenorrhea, D. Amenorrhea. Answer is A. Menopause. So, menopause is the permanent cessation of menstruation. Painful menstrual cramp or painful menstruation is called dysmenorrhea. Absence of menstrual period in a woman of reproductive age is called amenorrhea. So amenorrhea is the absence of menstrual period. The first menstrual cycle or first menstrual bleeding is called menarche. Menarche is the first menstrual cycle or first menstrual bleeding. Next question, platelet count decreases in options A. Malaria, B. Filaria, C. Dengue, D. Typhoid. Answer is C. Dengue. So dengue, also known as break-bone fever. It is an acute febrile illness often presenting with severe musculoskeletal pain caused by arbovirus. The disease is transmitted to humans by the bite of the Aedes aegypti mosquito. About 5% of patients develop bleeding into the brain and lungs with severe neutropenia and thrombocytopenia. It is known as dengue hemorrhagic fever. Next question, chronic diarrhea is caused by options A. Corynebacterium diphtheriae, B. Intestinal parasites, C. Candida albicans, D. Mycobacterium tuberculi. Answer is B. Intestinal parasites. So chronic diarrhea is caused by intestinal parasites. Next question, of the following, which is the most common site for metastasis in lung cancer? Options A. Kidney, B. Stomach, C. Liver, D. Spleen. Answer is C. Liver. The most common site of metastasis for lung cancer are adrenal gland, bone, brain and liver. Next question, which cellular component is responsible for oxidative metabolism? Options A. Mitochondria, B. Receptors, C. Lysosome, D. HLA molecules. Answer is A. Mitochondria. Mitochondria contain the enzymes for the aerobic stages of cell respiration, and thus they are the sites of most ATP synthesis. So it is also called powerhouse of the cell. Next question, steroid synthesis occur within which of the following structure? Options A. Peroxisome, B. Mitochondrion, C. Golgi apparatus, D. None of these. Answer is B. Mitochondrion. So steroid synthesis occurs in the cytoplasm and mitochondria. Next question, when positioned properly, the tip of a central venous catheter should lie in options A. Superior vena cava, B. Basilica vein, C. Jugular vein, D. Subclavian vein. Answer is A. Superior vena cava. So when positioned properly, the tip of the central venous catheter should lie in superior vena cava. Next question, muscles of forearm is divided into which group? Options A. Anterior and posterior muscles, B. Lateral and parietal muscles, C. Superior and inferior muscles. D. Superficial and deep muscles. Answer is A. Anterior and posterior muscles. Based on location and function, the muscles of forearm are divided into two groups. The anterior compartment muscles, which function primarily as flexors. Posterior compartment muscles, which functions primarily as extensors. Within each compartment, the muscles are grouped as superficial or deep. Next question. What is the main source of energy for cardiac muscles? Options: A. Glucose, B. Fat, C. Protein, D. Lactic acid. Answer is B. Fat. Fatty acids are the heart's main source of fuel, although ketone bodies and lactate can serve as fuel for heart muscles. Heart muscles consume acetoacetate in preference to glucose. That is, there is no glycogen store in heart muscles. Next question. The function of smooth muscle is to: options: A. Create heat, B. Propel blood into circulatory system, C. Propel food through gastrointestinal tract, D. Cushion organs. Answer is C. Propel food through GIT. So the function of smooth muscle is to propel food through GIT. Next question. The base present in DNA but absent in RNA is: options: A. Guanine, B. Thymine, C. Uracil, D. Cytosine. Answer is B. Thymine. So thymine is the base present in DNA but absent in RNA. The base pairs in DNA is adenine, thymine, cytosine, guanine. In RNA is adenine, uracil, cytosine, guanine. So in RNA, instead of thymine, uracil is making pair with adenine. Cytosine and thymine, that is found in our DNA, and uracil found in RNA are pyrimidine. Adenine and guanine are purine. Next question. An energy consuming process by which cells of the human body absorb molecules by engulfing them is called: options: A. Lipid diffusion, B. Aqueous diffusion, C. Exocytosis, D. Endocytosis. Answer is D. Endocytosis. Method of ingestion of a foreign substance by cell is called endocytosis. Phagocytosis is a form of endocytosis. Discharge of particles from a cell is called exocytosis. Diffusion of a chemical through aqueous phase from a region of higher concentration to a region of lower concentration is called aqueous diffusion. Lipid diffusion involves diffusion from aqueous phase on one side of membrane with a higher concentration to aqueous phase of other side of membrane. It is the most common mechanism by which chemicals cross membrane barriers. Next question. Hydrolysis of fat by an alkali is known as: options: A. Esterification, B. Saponification, C. Emulsification, D. Peroxidation. Answer is B. Saponification. Hydrolysis of fat by an alkali is known as saponification. The reaction between alcohol and carboxylic acids to make esters is called esterification. So esterification is the reaction between alcohol and carboxylic acids to make esters. Mixing of two liquids that usually are unmixable together to form an emulsion is called emulsification. So emulsification is the mixing of two liquids that are usually unmixable together to form an emulsion. Any oxidation reaction, especially of an oxide, that produces a peroxide is called peroxidation. Saponification means the hydrolysis or the splitting of fat by an alkali yielding glycerol and 3 molecules of alkali salt of the fatty acid. Next question. Stillbirth rate includes baby's death after options A 20 weeks, B 24 weeks, C 28 weeks, D 32 weeks. Answer is B 24 weeks. Stillbirth means the birth of a dead fetus after 22 weeks of pregnancy or fetal weight more than 500 gram. Next question. What is the observation of tissues with the naked eye to study disease called? Options A. Molecular pathology, B. Experimental pathology, C. Clinical pathology, D. Gross pathology. Answer is D. Gross pathology. Gross pathology is the macroscopic manifestation of disease in organ and tissue that can be seen by naked eye. Example is malignant tumor. Clinical pathology is a pathology that uses clinical analysis and other laboratory procedures in the diagnosis and treatment of disease. Next, experimental pathology. The study of diseases induced artificially and intentionally, especially in animals. Next, molecular pathology. The study of the pathological effects of specific molecules. Next question. Biological barriers include all except options A. Renal tubules, B. Cell membrane, C. Capillary walls, D. Placenta. Answer is A. Renal tubules. Next question. Which of the following symptoms is common in clients with active tuberculosis? Options A. Weight gain, B. Increased appetite, C. Dyspnea on exertion, D. Mental status changes. Answer is C. Dyspnea on exertion. The signs and symptoms of active tuberculosis includes chronic cough, sputum, dyspnea on exertion, fever, sweats, and weight loss. Next question. What is the normal pulse rate of newborn? Options A. 140 per minute, B. 130 per minute, C. 120 per minute, D. 110 per minute. Answer is A. 140 per minute. Some of the normal physiological characteristics of healthy newborn are pulse rate 120 to 160 beats per minute, average 140 beats per minute. Respiratory rate 30 to 60 breaths per minute, average 40 breaths per minute. BP 80 by 46 mmHg. Temperature 36.5 to 37.5 degrees Celsius. Next question. How many fontanelles are present at birth? Options A. 4, B. 6, C. 2, D. 8. Answer is B. 6 fontanelles. At birth, there are 6 fontanelles for a newborn. Fontanelle or fontanelle is an un-ossified membrane or soft spot lying between the cranial bones of the skull of a fetus or infant. There are 4 minor and 2 major fontanelle. 4 minor fontanelle includes 2 anterolateral and 2 posterolateral fontanelle, and 2 major fontanelle includes anterior fontanelle and posterior fontanelle. Anterior fontanelle is diamond shaped and posterior fontanelle is triangular shaped. Next question. Which of the following is significantly different between human and cow's milk? Options A. Proteins and fat, B. Proteins and sugar, C. Proteins and lactose, D. Minerals. Answer is C. Proteins and lactose. Significant difference between human and cow's milk are amount of lactose and protein. Lactose in cow's milk is about 4.5 gram per deciliter, and in human milk it is 7.5 gram per deciliter. In case of protein, cow's milk contains 3.4 gram per deciliter of protein, and in human milk it is only 1.2 gram per deciliter. Next question. Bedwetting by a child at the age of 5 years is referred as options A. Emesis, B. Enuresis, C. Encopresis, D. Enthetic. Answer is B. Enuresis. Enuresis is the involuntary discharge of urine after the age at which bladder control should be established. An example for a drug that is used in case of enuresis is imipramine, which is a tricyclic antidepressant. Encopresis is the voluntary or involuntary passage of fecus in children who are 4 years or older and after an organic cause have been excluded. Next question. When are the chances of acute endometritis developing in a woman? Options A. After menopause, B. After menarche, C. After abortion or childbirth, D. In childhood. Answer is C. After abortion or childbirth. Endometritis is the inflammation of the lining of the uterus, and it is most common among females of childbearing age. The highest risk is during immediate postpartum period. Next question. The test which is done to identify typhoid fever is options A. ELISA, B. ESR, C. Vidal test, D. Glucose tolerance test. Answer is C. Vidal test. Vidal test is a presumptive serological test used to assess level of antibodies in the blood against two antigen, that is first one O antigen that is appear on 6 to 8 days and H antigen which is appear on 10 to 12 days of infection. Next question. The characteristic of enantiomer is options A. Only that they are chemically identical, B. Only that they are mirror images of each other, C. Both A and B, D. None of these. Answer is C. Both A and B. Enantiomer or enantiomorphs are one of a pair of isomers, each of which is a mirror image of the other. They may be identical in chemical characteristics, but in solution, one rotates a beam of polarized light in one direction and the other in the opposite direction. Isomers are called dextro if they rotate the light to the right, and levo if they rotate the light to the left. Next question. A surgically planned incision on perineum. Options A. Hysterectomy, B. Episiotomy, C. Suction evacuation, D. Dilatation and evacuation. Answer is B. Episiotomy. Episiotomy is the incision of perineum at the end of the second stage of labor to enlarge vaginal opening to avoid spontaneous laceration of perineum, to minimize fetal intracranial injuries and to facilitate delivery. Different types of episiotomies is there. First one is the mediolateral, which is the most common. Next is median episiotomy. In this there is a risk of injury to anal sphincter is present. Next is the lateral episiotomy. There is a risk of injury to Bartholin's gland in this incision. And next is J-shaped episiotomy incision, which is not widely used. So friends, these are some of the questions that were asked in RRB Staff Nurse exam previously. If you like this video, please like it, share it and subscribe it. And also click the bell icon so that you will get notifications if I am uploading new videos. And thank you for watching my video and just wait for next video.